Republicans launched their plan for shriveling Barack Obama's health care law, edging a step closer to their dream of repeal with a bill that would slice and reshape Medicaid for the poor, relax rules on insurers, and end tax increases on higher earners that have helped finance expanded coverage for millions.
The Senate bill is crammed full with just as many tax cuts as the House bill.
Obamacare isn't working by nearly any measure. It has failed, and no amount of 11th hour reality denying or buck passing by Democrats is going to change the fact that more Americans are going to get hurt unless we do something.
That's the argument.
Joining me now to discuss what's in the bill, what happens next, is News4JAX political analyst and JU Public Policy Director Rick Mullaney. Rick, reaction to the measure was swift and varied. The president went in saying, "I wanted a plan with heart." It was unveiled. He called it very good. Senator Chuck Schumer called it a wolf in sheep's clothing. And President Obama, who really has been very quiet about anything related to the president's policies, called it mean-spirited. What's the good, the bad, and the ugly here?
Well, there's a partisan divide as usual. You go to the Wall Street Journal, they said this is an improvement, although not perfect. You look to the New York Times, they said this is a tax cut that does it at the expense of poor people. The good, the bad, and the ugly is basically this Senate bill repeals many of the taxes, nearly all of the taxes of the Affordable Care Act. By the way, that was 21 new taxes that raised $1.2 trillion over 10 years that was spent in large part for Medicaid expansion. And what you have here under the good, the bad, and the ugly is significant reductions, over $800 billion in cuts to Medicaid and the elimination of the mandates. So under the Senate bill, repeal taxes, cut spending, reduce coverage is what you're going to see quite a bit.
I'm going to take a lot of heat for asking this question, but I think it's fair. This is a political football. Is it about more than just repealing Obamacare? Because neither the Senate nor the House version really expands coverage.
Clearly, it does not expand coverage. And when the CBO report comes out by the latest on Monday, I think you're going to find in their report that it clearly does not. We can talk about that in a bit. But in the end, I think for Republicans, for many, this is about the political accomplishment, legislative accomplishment of simply repealing the Affordable Care Act. Others truly do believe that Obamacare is exploding and that they need to do something to stabilize these markets. And to get out in front of that, they want to replace it with something that they believe is stabilizing. It's going to be a tough sell to many, though.
You brought up the CBO, so let's go ahead and talk about it now. Before the Senate can vote on this draft, it has to go to the Congressional Budget Office. When they issued the report about the House version, the thought was that 23 million fewer people would have coverage after 10 years went by. What do you think the CBO is going to come back with when it comes to the Senate version?
Two big things to look for, and neither one really will be a surprise. One is you can expect the CBO report that say millions of people will lose coverage, and that's for a couple reasons. One is when you reduce the spending, dramatic spending on Medicaid, which the Senate bill does. It has a longer phase out than the House, but it has deeper cuts. When you do that, cuts in Medicare, and then when you Medicaid funding, and then when you eliminate the mandate, both the personal mandate and the corporate mandate, you're going to have less coverage. The second is it will reduce the deficit somewhat. That's because of the cuts in spending. But under the reconciliation bills of the Senate, it has to do that, or else it can't get through the Senate under the parliamentary rules that they have in the Senate. So look for those two items.
Are there enough votes? Because right now you've got a number of senators, including Republicans, who are wavering, and they're saying, first of all, Mitch McConnell's trying to railroad this through. We just don't have enough time to digest and finesse this bill.
If the vote was today, the answer to that question is no. The Republicans have a 52 to 48 majority. They have a margin of 2 here, and Senator and Vice President Pence can break that tie. However, if they lose 3, it loses. Right now, you have 4 Republican senators who've voiced opposition to the bill for different reasons. Some care about expansion. Some, like Rand Paul, believe it's Obamacare light. Others, like Ted Cruz, want premiums lower. But you have 4 senators complaining. You have other senators that are concerned, like Susan Collins, who doesn't like the defunding of Planned Parenthood for a year. So if the vote were today, no. The vote's going to be pretty quick, probably next week. Many people say never underestimate Mitch McConnell, but there's a long way for this to go. Even if you get the votes in the Senate, then it's got to get through the House.
And you and I were chatting off air, and Rick basically said, you know, this plays, some of these things play differently in Ohio than they do here in Florida, so we'll have to wait and see. More on this ongoing debate on News4JAX.com. Rick, thank you. We'll be right back.